Hi, good morning or afternoon, depending on when you are viewing this video. I'm Dr. Denise Rassel. I am a chiropractor in Lansing, Michigan, and I am the on-site director of Gilead Healing for internet. So anyway, this is Mary Tocco, everyone, and I consider her my friend. I've known her professionally for 20 years. Before that, my parents are chiropractors, and I would hear her speak from time to time prior to even considering going to chiropractic school. So Mary's been in the field of educating the public and educating patients and chiropractors and other people in the health profession, really the whole world, with her books and videos on all the vaccine research that she's done and the speaking. So Mary, why don't you introduce yourself?
Well, glad to be with you again, my sister in the Lord.
Yes.
I always say that I feel like you're more of a sister than a friend, but it's wonderful to be with you there. And of course, I am originally from Michigan. I currently reside in South Carolina, but my background is basically I began researching vaccinations over 40 years ago before having my first child in 1980. And I was married for 24 years to a chiropractor, and we have 5 wonderful children, and now we have 9 grandbabies. But we decided years and years ago that there was enough information back then to warrant some concern about using vaccinations. And of course, chiropractors have always led the arena in natural health care. They have always been the physicians that recognize the power of the human body to heal. They've always recognized God's amazing creation. And so to almost violate it with injections that are foreign to the human body in trying to control bacteria and viruses, it didn't make any sense to us. And we decided that we were never going to vaccinate back then. And so now, as I stated, I have 9 grandchildren. And in 1995 in the state of Michigan, I actually testified before the Health Policy Committee in Lansing, because back then they were trying to remove your philosophical exemption. Now, for people that don't realize, you have 3 exemptions in Michigan. You have the religious one, which we're going to talk about today. You have the philosophical one, and then there used to be one called the medical exemption, and that was for children that were injured or had neurological problems. They used to say that that was a reason to not vaccinate. Now they no longer acknowledge that. They vaccinate everybody, even if they're injured. So I testified before the Health Policy Committee, along with a group back then called Michigan Opposing Mandatory Vaccines. That group is responsible for you having 3 exemptions still on the books. They are now called Michigan for Vaccine Choice, and they need your financial, moral, and spiritual support, because they are fighting for your rights in Michigan all the time. So if you don't know who they are, go to Michigan for Vaccine Choice, join them, and please support them. In the meantime, I just continued my research, began public speaking in 1995, produced my first DVD in 2006. I now have a new DVD series that's a couple years old. I have a book that I recently published about the benefits of natural immunity, educating people on why the immune system is able to defend us. You know, God did not make any mistakes when He created us. And so I've been publishing that and several other tools for families who want to back away, do some research, and maybe raise their children more naturally without the use of vaccinations and dangerous drugs. So,
Amen. How do we get that book, Mary?
It's available on Amazon, and it's called Natural Immune Development, A Deeper Understanding of Our Immune System. And if you just look up Mary Tocco Natural Immunity, it'll pull up. It is also downloadable on Kindle. And if people go to my website, where I have other things that they can purchase for educational reasons, I can get it. You can get it from there as well. So you have 3 different ways that you can purchase this book. It's only 85 pages. You will get through it in an afternoon. It's backed with total, nothing but research, documentation. I quote some of the leading immunologists that believe what we are doing with vaccinations is destroying humanity. So it's just a really good, easy read for anyone who's on the fence or maybe doesn't know better.
Well, no kidding. Mary, just 2 days ago, I had a patient come in. Now, she's been coming in since we opened our doors in East Lansing. And she was a pro-vaxxer. Back then, she had a baby, a toddler. And this toddler is now a woman, and she's pregnant. And so unbeknownst to me, that this woman who's pregnant standing before me was her daughter. And I didn't figure it out until after a couple adjustments, because she said, my mother asked me to ask you about vaccines. And so I'm like, who's your mother? And then she told me. Well, her mother came in, and I know this mother. She was totally pro-vax, 20 years ago when we were taking care of her when we first opened. And she said to me, I want you to know, this is 20 years later, almost 20, 19 years later, she says, I want you to know I am not for vaccines anymore. I had a vaccine reaction. My daughter had a vaccine reaction where she dropped. Now, she was a teenager. I believe it was the HPV vax. And she dropped immediately after being injected, fell on the floor. And ever since then, her muscles on one side of her body don't work right. That was a year ago, she said.
Sounds like a stroke, huh?
Exactly.
Yes.
Exactly. So it's amazing that it takes injury to wake people up. I mean, I really couldn't believe it, that what I was hearing, and it breaks my heart. Mary, another case, a mother, she is she's a Medicaid patient. She has no teeth and 3 children. She brings in her baby who is 13 and a half months old, who will not put weight on her feet. She won't put weight on her feet. So she brought her in, I did an exam, and yeah, she was subluxated in her sacrum and her legs. And after a couple of adjustments, and her subluxation was clearing up, she still wouldn't put weight on her feet. And then I go back, I said, you told me that she has 3 children. You told me that your oldest child is violent autistic. Your second child is learning disabled. And now this one can't walk. And her greatest fear is that this child will never walk. And I said to her, all of a sudden it dawned on me that she's predisposed for vaccine injury. Now this child is, by the skin tone is of mix. And I go out and meet the father, and he's American Indian. And so I asked him, I said, he says, what's going on with my child? And I said, in my heart of hearts, I believe that it's been vaccine injury, that you have a predisposition even genetically for this. Right. So it breaks my heart. All I have in my tools are my hands in prayer.
Dr. Denise, I have seen this thousands of times over the last 25 to 30 years. Not only vaccine injury, severe vaccine injury, but many, many babies that die the first year of life for so-called no unknown reason. And they're calling it sudden infant death syndrome, or whatever. They're labeling it as a SIDS death when these kids are 7, 8, 9, 10, 11, 12 months old. Kids don't die of SIDS at 12 months old. It's clearly got to be related to something environmental that's happening to their body. And what happens more consistently than anything else is vaccinations injected into the deep muscle, being picked up by the body and circulated around the whole body, causing neurological injury on many, many, many levels. And again, I covered this in detail in my little book. And it's just, to me, it's a crime on humanity. But unfortunately, so many people never have even been taught to question this, and they trust their physician. And this is not an attack against physicians. Physicians only get about a half a day of training on vaccines in school. They really don't themselves, many of them, understand the danger, but I think a lot of them are waking up now. But ultimately, we as parents have to be responsible and look at everything that we're injecting into our children and everything we're feeding our children, because there are other circumstances that are contributing to this crisis of healthcare in our country.
So let's talk about vaccines. You and I know what is in a vaccine. We probably don't know the extent of what is in a vaccine. We do know that aborted fetal cells are in vaccines. We do know that animal cells and insect cells are in vaccines. We do know that eggs are in vaccines. We do know that peanut oil. What else?
Well, I think my biggest concern right now is the aluminum levels. And people think, oh, well, aluminum's normal and it's natural and it's found in foods, and we get exposed to it in our lungs, in our environment, which is absolutely true. But the type of aluminum that is in vaccines is very different than the kind that you get when you eat. And the amount of aluminum in vaccinations is absolutely criminal. When I'm pulling up my lecture so I can reference it right now, but I'm going to talk to you about the level of aluminum and the lack of safety studies done. There are no safety studies done to see how aluminum affects young children or even adults for that matter. We know that it is a neurotoxic element. We know that in high levels it's dangerous. And for some reason, vaccinations defy all of that. And so when we're talking about like injecting something into a brand new baby at the hospital, it's absolutely incredible that we're doing vaccinations the day they're born that are very, very high in aluminum. So first of all, what makes vaccinations unsafe are adjuvants. A vaccination has something called an adjuvant in it. An adjuvant is designed to turbocharge the reaction in the human body. So it's causing an immune reaction to whatever's in the vaccination, so that the body eventually would create antibodies against the viral part of that vaccination. The problem is the immune system responds to everything in a vaccine, not just the viral component. So anything that's in that vaccination, your body has to respond to. And adjuvants are there to turbocharge that reaction. They are highly variable in terms of how they react in the immune system. Very little scientific study has been done on this. And there's really actually no study to know how dangerous they are. But one of the top adjuvants that we use is aluminum, and aluminum hydroxide, aluminum phosphate, aluminum potassium, and alum. And so there are many, many other adjuvants, but this is the number one adjuvant that was put in when we removed the mercury thimerosal. We actually reduced the mercury thimerosal around 2003. And they had to put another adjuvant in or the vaccine would not be effective. And they chose to put in aluminum. So there was one study done before they added it called the Aspen Study, 1994. And I encourage people to take notes, look this up. Don't take my word for it, but you might have to look hard. They're trying to remove this information, but if you can't find it, you can email me, Mary at marytocco.com, and I'll get you a copy. But it's called the Aspen, A-S-P-E-N, study, 1994. And they took 100 premature infants born in the hospital. And unknown to me before this study, there's aluminum in the IV nutrition that they give to these babies. So you've got a brand new baby, could be several weeks early, and they're in the hospital, they're getting fed via IV, excuse me. So this is called the American Society for Parenteral Nutrition, which is intravenous nutrition. So they took 200 babies, and they took 100 of them and reduced the aluminum levels in their nutrition, and then they left 100 babies with the regular amount of aluminum. And the results of that was anything over 20 micrograms of aluminum would lead to neurological delays at 18 months. They followed these children. They saw that the ones that got the full amount of aluminum was they had neurological delay. And they found later on in life that they suffered with problems with bone density and other physical problems. Excuse me. So they said anything over 20 micrograms could be toxic for young babies. And so we go, parents go to the hospital, they have their first child, they don't realize that they're automatically going to give that baby a hepatitis B shot. The hepatitis B vaccine contains 250 micrograms of aluminum the day they're born. So that vaccination is about 100 times stronger in the aluminum level. And then every couple months, moms are told to bring their babies in for their well baby checkup, where the whole purpose of that checkup really is to vaccinate your children. And at that time, that baby's going to get multiple vaccinations. Excuse me. And by the time that child is 18 months, they will have received 4,925 micrograms of aluminum through their vaccinations alone.
By the time 18 months?
18 months, 4,925 micrograms of aluminum. So that right there sounds really horrible. And there are no safety studies. They actually do not follow through and do safety studies to see how this is affecting the children. Now, since those, in past recent years, I will tell you of a study that did come out, the Journal of Trace Elements in Medicine and Biology. They actually took brain tissue from children with autism who died, and they looked to see the amount of aluminum in their brains. And they'd use fluorescent microscopy. And again, this is a true study done, and you can look it up, aluminum in brain tissue in autism. And they found that these children had such high levels of aluminum, it was astronomically higher than even people who died with Alzheimer's disease when they were old. So we know that this aluminum is getting into the brain. And many other vaccine ingredients actually open up something called the blood-brain barrier. That is basically dense cells that God put there to protect your brain from toxins getting into it. It's called the blood-brain barrier. And there are vaccine ingredients that actually, or adjuvants and additives that actually open up the blood-brain barrier. So your children's brain, along with their lungs, and along with all their other organs, are being exposed to high levels of aluminum.
Criminal.
Anything, I know it is. It's absolutely terrible. Excuse me. And then we have several, and all of this, by the way, I reference all of this in my DVD series called Vaccination Risks, Responsibility, and Rights. That vaccination series is available on my website. You can either download it in parts and get one part or all 6 parts. It's up to you. Or you can order the whole DVD series and you get the whole thing, which I encourage people to do that, because then you can literally get together with mommy groups, family members, relatives, and you can watch a part or two a night and have open discussion and debate or whatever it is. But it's all about, God says that my people perish for lack of knowledge and lack of understanding. And that's, by the way, in Hosea 4, verse 6. But what else it says in that verse, which I think we all need to be aware of, is because thou hast rejected knowledge, I will also reject thee. Thou shalt be no priest of me, seeing that thou hast forgotten the law of thy God. I will also forget thy children. So God's law tells us that we are destroyed because of lack of knowledge, and that we reject knowledge. So right now, if you're listening to this and you're a Christian, just know that, number one, this message is coming to you in a timely manner, that this is a God appointed meeting with you. And number two, we are giving you crucial information with proof, scientific proof, and it's up to you to take the time and make it a priority and research for yourself, for your children, and for your grandbabies. Because the last thing you want to do is to answer to God someday. So again, another thing that I like to talk about are the use of aborted fetal cell tissues in the manufacturing process of vaccinations. The abortion industry literally for years has been selling their babies. They try to get them whole, they try to keep them intact, and they prefer them to be born alive. And I know that sounds horrific, but it's a fact. And I back all of this up with documentation. But I created a brochure on this topic, and it's called Aborted Baby Tissue and Vaccines, a Moral and Ethical Dilemma. For anybody that wants these, I sell them in bulk. But inside of it, I actually have documentation, and I give you references and everything. But there are currently 32 vaccinations that are developed using aborted fetal cells from infants. So that right there, folks, is a religious exemption to vaccinations. And so I give these tools to people because I want them to wake up. It's very, very important that we are willing to do the research, even though it might be painful, it might be grueling. You might be a nurse out there who's been responsible for giving vaccinations in a pediatrician's office. You might be a doctor out there who's been doing it for years and has a gut feeling that something's wrong. Or you might be a grandparent who's having grandchildren, and you see that your grandchildren are not developing like they should. This is an opportunity to share the truth with people.
Mary, let's talk about aborted fetal cells. Now, you know, we didn't know that that was in a vaccine. I mean, it started to trickle out probably in the last 5 years, and now it's a full blown admission, even on the vaccine packages, of what's in it. Now, you know, I have to say I don't trust that everything is on the vaccine insert, but they do put this on there, is that DNA. So, you know, I fathom that and how that response is in the body. So if we inject both male and female DNA into a human, that changes our DNA.
I believe it's one of the causes for gender confusion that's going on.
Gender bending, yep.
Yep, absolutely. Not only are there incredible amounts of hormone disruptors through all of the toxins, and we'll talk more when we can about more vaccine ingredients, but hormone disruptors go in and throw the delicate balance of hormones off in the body. You know, we don't just have 3 or 4 hormones. We have dozens and dozens of hormones that are all working in a beautiful dance to create our life expression. And when you go in and disrupt this balance, it throws everything off. And yes, when you inject human DNA from another, other human DNA into another human being, it causes many, many things. We don't even know the full extent of it yet, but it also can lead to autoimmune problems, because your body, first of all, the blood system is kept very pure by the human body. And when you inject a vaccination, inevitably these things are going to get into the human body. Yes. The immune system attacks whatever gets in there because it doesn't belong there. And so in this process, it is fighting these foreign products put in the body and causing an immune reaction to them, which eventually will cause hyperreaction to those very things. So your body recognizes foreign human DNA that doesn't belong there, it's not theirs, and it fights it, and before you know it, it causes all these trickling effects. And this is actually, there's not enough study done on this to even see the long-term effects, but I think we're seeing evidence of it in society. And it breaks my heart. You know, Dr. Denise, years ago when I was a new Christian, I had a belief that, you know, this genetic mutation taking place in society, that it was basically a sin, based on our choices. Now I'm seeing it differently. I'm seeing that it is a consequence of what we're doing to the human body, to these babies and these children. And when you run into these human beings that are so gender confused and so obviously out of balance, it breaks my heart because it's not their fault.
I agree.
It's not
I
their
agree.
fault. This is something we have done. And it's not just the vaccines, it's the air, it's the water, it's the other chemicals that we're eating in foods and breathing and being exposed to. This is basically based on the sin of man and not necessarily that child or that young person who is now so gender confused. They don't know if they're male or female, and they don't even know how to dress or act because they feel so foreign in their body. Very sad.
Yes,
But I can
it's
read
very sad.
in my the brochure that I created here. I will read a quote. Yeah, where's my quote? Where's my quote? Okay. On the back of my brochure, Dr. Disher is president of Sound Choice Pharmaceutical Institute. She is fighting the use of aborted fetal cell tissues in producing vaccinations. And this is what she says. The practice of using aborted fetal cells or vaccines and drugs production creates a wrenching moral dilemma for parents and consumers. It ignores informed consent rights and exposes our children and ourselves to contaminants lacking safety evaluation. We cannot ignore this issue in good conscience, and we cannot afford to wait. Furthermore, it is unconscionable that the public health risks injecting our children with residual contaminating human aborted fetal DNA has been ignored. So there are plenty of doctors and researchers now who are admitting this. It's no longer hidden, like you say, it's out there. You just have to know how to find it. And I've made it pretty easy for you to find all the information.
It's scary. It's scary. And
It is.
even though we are not given a spirit of fear, but of a sound mind, love, power, and a sound mind, power, love, and a sound mind, with a sound mind, we must address these issues. If one is a Christian, if you stand on the Bible, if you stand on the Bible, if you took all these ingredients and put them in a bowl and stirred it up and injected, you know, you've got vaccines are made out of human DNA, out of animals, you know, dogs, pigs, chickens. These are all cells and DNA as well being injected into our human babies. What does the DNA of an animal do? That's never been studied.
Well, and that's why I believe that anybody who's been currently vaccinated in the last several years with the flu shot or even childhood vaccinations will test positive for coronavirus, okay? Because coronaviruses are animal viruses, they're not human viruses. And we've been using animal parts for years and years and years to develop vaccines in laboratories. And then, like you say, injecting them. And when you inject a vaccination that has been developed on kidneys of monkeys or hamster kidneys or caterpillar DNA or pigs, cows, different parts of their bodies, and you inject that into the human being, you're going to get foreign viruses from those animal parts. And those are animal viruses. They do not belong in the human body. In fact, right when this coronavirus was introduced, I was watching Del Bigtree. I encourage everybody to watch Del Bigtree on YouTube. He has a program called The Highwire. He has an incredible past. He was a producer. He won Emmy Awards for producing the Doctor's Daytime program and the Dr. Oz show. He walked away from that to work on this issue, folks. He left a very lucrative, prestigious position and is working on this. He is in our back courts now. We need to support. His website is called ICanDecide.org. I tell people, send him money. Don't even send it to me. I'm okay, I'm eating, I'm fine. Send it to Del because Del is digging, probing, He's getting world experts in on his program. He's exposing the flawed science behind vaccines. He's exposing the fraud behind the COVID. Anyway, he did a program early on where he found out, he interviewed a genetic researcher who looked at the genetic packaging with this COVID-19. And this researcher said this only was made in a laboratory, could not be found in nature because it has something called a vector in it. A vector is a process where they combine two foreign viruses to make them respond and react to each other. And they put them together in a vaccination. So this is a man-made virus, bioengineered in a lab. We don't know how it got released. We don't know if it was developed for bio warfare. We just don't know. Nonetheless, this is what we call genetically modifying organisms. They are modifying organisms in laboratories, telling you they're safe, telling you they're effective, and encouraging you to take them. And so we have to really take the time, I said, like I said, to go into this and really look at it carefully. Because when you figure out what they're putting in you, you wouldn't eat it, let alone inject it to your brand new baby who doesn't even have a developed immune system yet.
Wow. Maybe that's what Bill Gates was referring to in his interview, that vaccines, they're injecting genetically modified organisms into children. That's what he said, injecting genetically modified organisms into children. Now, I'm left with the question, Bill Gates, what does that mean? Genetically modified organisms. What does that mean?
Show me the safety studies. There are none. One thing for sure, if people walk away with nothing but this, whenever a drug goes through the approval process, they spend millions doing lab testing. They use double-blind placebo studies when they approve a drug. And then that drug has to go into all kinds of studies. It could take anywhere from 8 to 10 years to get a drug approved through the FDA. And even then, people die from the drugs, okay? So the whole system is really, really messed up. But vaccines don't go through that. For some reason, they are like the sacred cow, and they don't have to go through any of these safety studies. They simply develop a vaccination, they try it out on a few dozen children, and then they ask for it to be put into the program, the children's program. As long as a vaccination is in the pediatric recommendations for vaccines, you cannot sue. So it really is, it's terrible what we're doing. It's criminal.
Well, they call it post-market
surveillance. Yes, they put it out there.
Yeah.
Exactly. They put it out there, but see, nobody's really watching what's going on after it's out there. The doctors don't want to admit that a child is vaccine injured, because then perhaps they could be liable through civil lawsuits. They make tremendous amount of money off of vaccinations.
Mm-hmm.
If you just acknowledge that you sign a form saying that you take the risk, they make money off of that. They have no incentive whatsoever to look into vaccine injury, because it would completely shoot their practice. And there are many, many pediatricians, by the way, who are acknowledging this and are walking away from it, okay? But anyway, I don't want to get off track there. But yeah, if a child gets vaccine injured, they can't be sued. You can't sue anybody for that injury. You are basically stuck with that injury for the rest of that child's life. And the only way you can possibly get compensation is if you go through a court system, which is really not a court system. It's called the Federal Court of Claims. And this Federal Court of Claims does not have a jury. It's a judge that's appointed, and your injured person is not allowed in the courtroom. And you have to present to them why you believe your child or you or your family member died from vaccinations. And no pharmaceutical companies are held liable for any injuries related to the pediatric vaccinations.
We need to reverse that law.
Yes,
That
we
flaw
do.
needs to be reversed, and then the studies will be done. And didn't Kennedy just win a big court battle,
Lawsuit.
a
Yes.
lawsuit that they proving that they have not done any safety studies in 30 years?
And what that goes back to is when Congress signed the Vaccine Assistance Act in 1986, they removed all liability from the pharmaceutical companies because they were getting sued back then for damages and were basically ready to go belly up. Now, instead of saying to those pharmaceutical companies, then make a safe product, do more safety studies. If you're being sued because so many people are being injured and dying, then there's a problem. We need to look at this. But instead, big pharma, they have their little fingers in everyone's pockets. Instead, Congress was, encouraged to sign this act. And they signed it, and so all liability was removed. And then they set up this court of claims, and they also, at that time, Congress assigned Health and Human Services, HHS. They were assigned the job of monitoring safety and giving us a written outline report every other year of how this is working out there. And Del Bigtree from the Highwire, along with Robert Kennedy Jr., ended up suing the Health and Human Services, and they won. And that was last year. As soon as Donald Trump got into office, he got them in front of the FDA, the CDC, HHS, the Institute of Medicine, and many other boards, and they presented with them all kinds of paperwork saying, you need to answer to us, where are these safety studies? And it took them a long time to respond. Eventually they responded, and they said none have been done. So HHS has not done what they were appointed by Congress to do for over 33 years. And all of this you can find out on Del Bigtree's program called The Highwire. He has one, Dr. Denise, I don't know if you saw it, but it's called Who is Lying to Who? And it's the WHO, World Health Organization, is lying to who, meaning us. And on there, you can actually see footage of their meeting, December 3rd, 2019, where all of the doctors are coming from all around the world to have this symposium. And it was supposed to be a celebration for 50 years of the World Health Organization vaccine program. It ended up being a huge debate. And the leaders of this World Health Organization said that, number one, the anti-vaccine movement is growing by 500%. Number two, they said that regular pediatricians are now losing faith in the program because we do not have the science to prove that these are safe. And number three, they do not know how a vaccine responds in the human body systemically. All they studied, and they admit this in their words, all they studied was the local reaction, meaning if you got it in the arm or if you got it in the leg, they studied that area for a couple days before they released the vaccine, not even considering how it's going to affect the whole body. This is malpractice. It's absolutely unbelievable that this is the organization that is telling the world what we have to do. And it's directed by the CDC.
So let's change a little bit, and let's talk about the current atmosphere in America regarding vaccines. Now, last year was the last push in California to make the governor, I believe, signed it into law that all children must be vaccinated before they can attend school. And I know personally people who have left California because they refuse to vaccinate their children. So they're leaving California. They don't want to homeschool, and they want to, protect their children. So they're leaving California. And then we have New York that they tried to push it through. They attacked a certain county who had a predominance of a certain religion, Jewish, and big battles, and they lost in that county, and the governor signed into law that every child, I believe, must be vaccinated to attend school in New York. And I have personal friends that have taken their children out of school and are homeschooling now.
Definitely.
And then progressing, then you had New Jersey, that the same type of push by politicians in New Jersey, and New Jersey stood up and won.
Yes,
And
they
then
did.
you see it going on to Connecticut, and Connecticut wouldn't take it either. They stood up to their elected politicians. Now, they're not medical doctors, they're just politicians, and they happen to have a bank account where whomever can sew into their bank account, and then that politician will vote, make that vote for mandatory vaccines. And then after Connecticut won, it wasn't a week or two later that coronavirus, not worse than the flu virus, but yet coronavirus, the media, it seemed like a coordinated effort. They even had a coronavirus practice session in New York City on how they were going to handle a coronavirus breakout. I mean, coronavirus has been predicted.
Even Fauci, even Dr. Fauci, and I hate to even call him a doctor, but he even predicted that during this administration, Trump's administration, they were going to have a major outbreak of a virus, and it was going to be world changing. And so there is, and this is not a theory, this is a basic fact that this has been in the making for a very long time. And so now our numbers are very low. The death rate, it was very exaggerated. And so it's really no more dangerous than a flu that runs around every year. And of course, the elderly and the autoimmune are the people who should be quarantining themselves or building their immune system, which is really important to do, folks. If we want to be strong and we want to live in this world where we are surrounded by millions of bacteria and millions of viruses, we have to have a strong immune system. And that, of course, is where chiropractic comes in. Good, obviously, holistic eating. And of course, I am a firm believer of avoiding artificial drugs and things like that if you can. But I cover all of that in my book. But, this whole thing, I believe, is a red flag. They're basically seeing how Americans are going to obey. I think it's a false flag. And so, as you know, I came up with something called the County Sheriff Action Plan for Citizens. And so when push comes to shove, they are going to legislate all kinds of crazy things. There's a lot of things that are in the making behind the scenes that we are not aware of. And when I say they, I'm talking about the World Health Organization, I'm talking about the deep state, I'm talking about the one world government people, and anyone who wants to do research on that, that's a whole other can of worms. But they have an agenda, and the agenda is to start monitoring you, forcing you to do vaccinations, and forcing you to be tested. And it's very, very frightening, like you say. So in my research, I discovered that your county sheriff has more authority than even the President of the United States in his state. He is more powerful than a governor, than a police officer, chief of police, whatever. Your county sheriff, if he was appointed, might be different than if you elected your sheriff. So that's the first thing that people need to know, is that an elected county sheriff is going to be more powerful because he is elected by the people to represent the people. In Michigan, you have several very good elective sheriffs who have already stood up and said, we are not going to give people citations and tickets for being outside in their yard or going to parks, okay? So you've got some good ones in Michigan. But this program, the more people that go to their sheriff and talk to them about their concerns, like being forced to wear a mask, which is your property rights being violated. Your body is your property. Nobody has the right to violate that and tell you have to wear a mask for medical reasons. If they're not a medical doctor and they're not your personal medical doctor, that's a violation of HIPAA. Okay, so that's one way you can protect yourself, is by saying, my health, I do not believe it's good for my health to wear a mask. And you basically say, are you practicing medicine with me? Are you giving me medical advice here or what? And that's one way that people can work against this whole propaganda that the mask is going to save you and you've got to wear a mask. But your county sheriff is the one person who can basically say, we're not doing that in this county. Your county sheriff could open up every business in your county and the governor has no power over it. He is also available to deputize as many people as he wants to defend your rights, your constitutional rights, and your Bill of Rights. And so I have this all done for people. I have a letter that people can get that is just a standard letter that you yourself can change or modify, but it basically says, in fact, I'll pull it up and I'll read it. I think I have it open here. Let me see if I have it open. What did I do with it? Here we go. So this is basically what the letter says, and people can, you can get this from me and you can send it to your sheriff, or you can, I'm going to suggest some things to do, but it says, as a citizen of this country, I'm deeply concerned about the erosion of my personal rights. I know that we live in trying times and that your job can be difficult. However, your oath of office is to protect the citizens of this county. I am here today to discuss my concerns about the following issues. And then you can mark off which any one of these applies to you. Forced mandatory vaccinations for travel, education, or any other reason. Discrimination against partially or unvaccinated children or adults. Such discrimination violates my medical privacy and is a violation of HIPAA regulations. Public or private harassment by the CDC, medical doctors, the military, the Department of Social Services, or any other agency. I refuse to answer to any person who tries to question me, and I will ignore any letters mailed to me by the local health department for the same purpose. Forced mandatory pandemic testing, which is flawed and inconclusive and is a procedure that is not necessary nor scientifically justified for asymptomatic people. Respecting my religious convictions. Many vaccines are produced using aborted fetal cell tissue, which is a violation of my Christian beliefs. And then it goes on and gives some basic Christian beliefs. I cannot, with a clean conscience, contribute or take part in murdering of our innocent children while profiting the vaccine industry. There are no safety studies showing that injected human DNA is safe. As a Christian, I will not support Planned Parenthood and the pharmaceutical companies who no longer have respect for the sanctity of human life and are profiting off of child sacrifice. My Bible says in Psalms 127:3, behold, children are a gift of the Lord. Fruit of the womb is a reward. And religious exemptions of vaccines. We have seen how California, New York, and other states have violated the religious rights by removing a religious exemption to vaccines. Okay? By the way, shame on California, shame on New York, because they, number one, they voted in liberal people who are pro-abortion, who are into socialism, and how ironic that those two states were the hardest hit with this COVID. Isn't that amazing? And you know what I tell people that live in those states? If you're a conservative Christian or even a moderate and you believe that abortion is wrong, or you believe that you shouldn't be forced to vaccinate, you need to get busy. You need to find out who's running for office in the future, and you need to get those elected officials out, and they need to be held accountable for all of their power-grabbing, wrong, telling people you can't go outside, you can't lay on dry sand on a beach and get sunshine. I mean, this is such a violation, Dr. Denise. And people are like sheep. They're just letting their governor say this without laws. This is not a law. And so anyway, this whole letter goes into it. And at the end, it says, it basically says that I want to know where you stand. And I encourage people to do several things. Number one, contact me, get a copy of my short PowerPoint, which outlines the power of the sheriff, and then find out if your sheriff is elected or appointed, okay? I will send you actual steps that you can do. It's called the steps to make this happen. I'm looking it up now. Then contact your local sheriff. Tell them that you would like to set up a meeting with them in person. Take 3 or 4 or 5 people with you. If no one will go with you, at least get a petition, which I've created, that they can sign, saying that you, as a citizen of that county, expect them to hold the oath of office they took. And that was to defend your constitutional rights. And so there's many ways that you can do this, folks, but you will not get your sheriff behind you if you don't talk to them about these specifics. And your sheriff will not do anything unless the people go to them and ask them to. Because if they're elected, they need to know their people are behind them. Okay, so that's why it's so important we communicate with them. If they're going, and by the way, this could be an election year for most of them. They're going to be running for office again. And if they know that they've got 500, 2,000 people in their county that are expecting them to uphold their constitution and defend their rights, they're going to do it for you. So we need numbers and numbers of people going, not just 5 or 10 or 15. We need lots of people contacting their sheriff and letting them know how they feel. And I recommend that you start by asking the sheriff, where are you at with forcing us to wear a mask, forcing our businesses to close, forcing us to stay in our house and not rake our leaves, forcing us to not go to church and assemble and worship our God. So there's a lot of things that you can do to stop this craziness when it comes to your county and your state.
Wow. That's a lot of food for thought, and not just food for thought. It's called food for action. You know,
That's
never, you know, as I was praying this morning, I'm like, Lord, you know, give us boldness, give us courage. And, you know, every day I see people, I've had Christians, Christian actually pastors that won't address the vaccine issue. I've had patients who are Christians quit because I stand, I speak up. I've been speaking on this since my feet hit the ground. You
Exactly.
know, even though I didn't quite understand completely the science behind it, I knew it was wrong to inject. Even before the aborted fetal tissue came out, it was the mercury. Even to inject, I just don't believe, there's nowhere in the Bible that says we are to inject our bodies, that God made a mistake. God did not make any mistakes when he built the human immune system. He didn't.
No, he didn't. And when we trust man, especially men, we know that governments are corrupt. We know that the devil's working overtime. When we put our trust in man and science, we are literally saying, sorry, God, but you're flawed. You made flawed human bodies. And out of fear, I'm going to listen to these people who are making billions and billions of dollars off of this. You know, the new coronavirus vaccine, supposedly, Fauci himself is set up to make millions of dollars off of that vaccine. And when you look back at who he's associated with, they own the patent on the vaccine. So this is truly, there's an agenda. And it's not a conspiracy theory. There's plenty of proof out there. And my wish is that God will expose all the lies. I do believe that our president is trying his best to let them hang themselves. You know, I don't agree with everything the president does or says, but my gosh, he's pro-life. He's trying to defund Planned Parenthood. He's done more for this country in the last 3.5 years than any other president. And I truly believe that God appointed him in this position, and that we as Christians need to vote for the people who are going to protect and understand human life, at the sanctity of human life. That's first and foremost. And when you see that the vaccines are made from aborted baby tissue, that in itself should tell you where they're at. I mean, are they on the good guy team or are they on the bad guy? Are they serving God or are they serving Satan? And so really that's what it comes down to in my book. I've always tried to vote for whoever's pro-life and understands the sanctity of human life and has some Christian principles. And so, again, this isn't a political talk. It doesn't matter where you are on the spectrum. The bottom line is your rights are being violated. There's a whole plan coming to spy on you through your cell phones. By the way, if you download certain apps, they're going to be able to go into every person in your cell phone and know who you're talking to. And if you have a fever, if you just have a fever walking into a building or a business or on a plane, you will then be quarantined. I mean, what's coming is absolutely crazy. So we have a very short window, folks. I do believe we're in the birth pains of end times. I think the signs are all over the place, and we have to be the wake-up call. God holds us accountable for what we do, and we all have to start within our own families and our own small circle of friends. And the Bible says, fear not. In fact, 365 times the Bible says, fear not. And that's once for every day of the year. And so when we allow fear to paralyze us, that is not of God. That is of the devil. When we allow fear to keep us from saying something to someone we care about, that's putting our ego in front of serving God. We don't want them to be offended by us. That's our ego. We don't want to offend anybody. We don't want to be the bad guy. We don't want to be considered a crazy person. Whatever it is, that's all fear driven. And if you come out of compassion and love.
That's fear of man.
Exactly. We need to fear our God.
Fear
because
God.
now, if you've heard this information, you are now accountable before God for what you do with it. So when you get done hearing this, look up your local sheriff, Google it, call them, email me, mary@marytocco.com, or find me on Facebook and ask for my sheriff plan. Mary Tocco, it's real easy. I can't take any more friends, but you can still message me. I have another page, Mary E. Tocco, and so I have 2 pages. And ask me for the sheriff plan of action. I'll give you everything you need free, no charge. My goal is to help people help themselves and help their communities to do what we can to hold this off as long as we can, because we are running out of time.
Yep, I agree with you, Mary. And my prayer is that, number one, my Christian brothers and sisters, that their eyes be open and their ears be open, and that they, as scary as it might be, is to take a stand. That we are called to be holy and set apart. Our bodies are the temple of the Lord. And we need to hold these bodies in reverence as a living sacrifice to the Lord. Now, I believe in miracles. I believe that the Lord may do some miracles in this time frame of reversing vaccine injury. But my true desire, and I love, even if you made the decision to vaccinate, I still love you. I'm not judging you. I'm not condemning you. I want to help you. I want you to just listen, and hopefully you'll make different decisions. Now, that's not my decision to make for you. It's your decision. And I just pray that my brothers and sisters, their eyes and their ears be open, and then people in the world start to wake up to the agenda of the enemy. So the higher agenda is the agenda of the enemy, which is to rob, kill, and destroy.
That's right.
I'm not sure that order, but rob, kill, and destroy. So they're robbing people of health. They're actually killing infants, even infants in the womb, abortion, post-birth abortion, live birth abortions. It's absolutely horrendous. And then it's horrendous what we are allowing to be injected into the little gifts of God, these little babies that are being born right now, and injecting them. And it starts even before they're born. with injections. When I was pregnant, we couldn't even take an aspirin. You know, there was no injections, no aspirins, no nothing. And now they're trying to give pregnant women vaccines, which is completely beyond my imagination. They're just not thinking for themselves.
No, and really this young generation, they are so, when it comes to this information, well, I guess it goes two ways. They're either very lost and they do whatever they're told because they're not really taught to think. And then you have the warrior moms who have seen their children get injured, and they're out there warring against this. And this is a spiritual war. This is a war against principalities that want to destroy humans. And when you think about it, how many Christian parents have vaccine injured children? I'm going to list real quickly. I know we're probably getting close to running out of time, but I want to list all of the things that children in this country are suffering with that were not here 30 years ago. Okay. And I've got in my DVD series, I have all of this referenced, and I show you documentation, medical research documents showing how vaccines are causing all of these issues. But we have vaccines and autoimmune disease, vaccines and deafness. The vaccines and deafness, I have got 12 studies showing that vaccines can cause deafness. How many kids are getting cochlear implants and are deaf? Vaccines, excuse me, demyelinization. Our babies are developing the myelin coating on their nerves for 5 years after they're born. And that would be similar to the electrical cord. It's like the outer coating on the nerves, much like this electrical cord. They are creating myelin coating on their nerves. Seizure disorders is a disruption of that myelin developmentation. I have 2 or 3 pages full of medical documentation showing that vaccines cause demyelinization. That used to be an injury you saw in senior citizens. As they got older, their myelin coating would disintegrate. We now see it in children. Vaccines and diabetes. Diabetes was very, very rare 30 years ago in children. Now we have so many children on insulin. Encephalopathy is brain inflammation. I have 2 slides, total of 10 studies showing that vaccinations cause encephalopathy, brain inflammation. Vaccines, leukemia, and lymphomas. Another 10 studies just on that. Vaccines, seizures, and convulsions. 15 studies on vaccines causing convulsions. Vaccines and skin disorders. Vaccines and sudden infant death syndrome. 2 pages, 16 studies showing that. The sobering fact is, Dr. Denise, that our children were healthier when you and I were growing up. When I was growing up, I didn't know anybody that had any of these problems except for one girl in our school who had to take insulin. She was diabetic. One person. And it was such a big deal because she had to go to the office and get a needle and get injection. My point is this was so rare that you knew the one person who had to go to the office every day in school and get her injection. Now kids are getting drugs all day long, every day. So our children's health is destroyed by the use of vaccinations as well as other things in our environment. But I believe vaccines are the #1 assault on the human body because they're done the first day of birth and they're done the first 2 years of life, and unlike any time we've ever done before in history. So we really do have a crisis here in our children. And those children are going to somehow either be leaders or they're going to be slaves to this problem that we have. They're going to be slaves. They won't have the ability, you know?
They're a creation in order to supply the pharmaceuticals for the rest of their lives.
Yes.
The pharmaceutical industries, the medical machine.
Yeah, it's devastating. So I would love feedback, from your audience. If they want to email me, ask questions, I'm available for them. But we have to see that people are getting into action. We no longer can sit back and assume someone else is going to do the work for us. In Michigan, join Michigan for Vaccine Choice. Support ICanDecide.org, O-R-G. That is Del Bigtree. We also can support Robert Kennedy Jr. What is this? The Child Defense Fund, I think is what that one's called. They, by the way, have more lawsuits coming. The only way you're going to stay in touch is by watching Del Bigtree. At least once a week, he posts something on YouTube. He does live Facebook all the time. Right now, he has 10 reasons that this crisis is a false flag. And this goes all the way back to his original research. You can look those up on Del Bigtree, on Highwire. But the bottom line is, be informed, folks. The blinders have to fall. We have to see what's going on around us.
Wow. Well, thank you so much, Mary, for your time today. The last minute interview, and I look forward to doing this again. I want to thank everyone for watching, and if you have any questions, you can contact me, you can contact Mary, and let's take the steps together, unified, and keeping our families healthy, number one, and our community and our Christian brothers and sisters. God bless.
God bless. Take care.